Hello, everyone. Welcome to Medicas Video Podcasts again. We have a very important topic to discuss today, which is the best diet for PCOD, Polycystic Ovarian Disease. We all know lifestyle as well as diet plays a very important role, especially for us as human beings, as we are a part of the nature, the natural food that we eat, the natural gas that we inhale, as well as the way we live our life with fitness or without fitness plays a very important role in terms of how our body gets adapted to the external factors as well as the internal factors. We have dietitian Neha Suryawanshi today to discuss about the best diet for those who are suffering with polycystic ovarian disease. Without wasting any time, let's ask dietitian Neha and get insights from her. I hope all of you are making a note of this. Otherwise, please pick up a pen and a paper handy. This is going to be a wonderful observation, and you can probably mark your comments down in the description, in the comments box, based on how you have felt after you have experienced and after you have followed the guidance from dietitian Neha, especially who are having this PCOD kind of a medical condition. Dietitian Neha, namaste, ma'am. Please
Yes,
suggest
namaste,
to our
Arun.
audience in terms of what is the best diet for them who are already having this medical condition called PCOD.
Yes, thank you so much, Varun. So today we are going to discuss Indian diet plan for PCOD, which any woman who is suffering from PCOD can follow with a lot of herbs, spices. Indian herbs or spices are used in this, and it is very easy to follow. It's a practical, doable diet which I'm sharing. Because a lot of women have issues like they are not able to follow the diet properly as per their hectic routine. The women who are working, the women who are at home, but still they are busy in doing the household chores and others. So this diet is a ease for them. This is absolutely easy and doable thing which they can definitely include in their diet. So let's start. Early morning, the woman who is suffering from PCOD should always choose these options. Like they can opt for fenugreek seeds water or methi dane ka pani, which is very good remedy for body pain relief also because it has anti-inflammatory properties. So fenugreek seeds, you need to just soak these 1 teaspoon of fenugreek seeds in 1 glass of water overnight, and you can drink this water in the morning. You can use these seeds also. You can chew the seeds if you like the taste. Otherwise, you can just strain the water and have it. Another way of taking this is you can just roast the fenugreek seeds, make powder out of it, and use this powder, sprinkle it on your salad and dal. So this will also help you. Another drink which is very important is curry leaf water. Curry leaves has a lot of benefits we all know as per the hair health, skin health, and PCOD women who is suffering from PCOD has a lot of symptoms related to their skin and hair health always. It's generally seen. So this remedy is very good for overall hair and skin health also. You just need to make dry. You can dry the leaves and make powder out of it, and take this 1 teaspoon of powder, curry leaf powder, in 1 glass of water. Another way of taking it, just boil 7 to 10 leaves and strain the water and have it immediately. This is going to give you a lot of antioxidant, vitamin, minerals which are required to reduce the symptoms of PCOD. Next one is moringa water. Moringa leaves, you can dry these leaves and make powder out of it again and drink this 1 teaspoon of powder with 1 glass of water. This is also very rich sources of antioxidant. We all know moringa leaves has a lot of benefits. Another way of taking liquids is like cinnamon, ginger, and lemon drink, which is very popular amongst all the women who are following the weight loss diet, who are following the diabetic diet, and along it has a very good results for PCOD also. So just take one cinnamon stick, boil it in water, add some ginger in it, and you can add half lemon into it and just take this drink. This is a wonderful drink in the morning. Early morning, after early morning drink, you can just keep a break for 20 minutes for having any other things. You can take some nuts also like dates, almonds, and walnuts after 20 or 30 minutes as per your routine. I will suggest you to do some walk in the morning because morning is the best time to do some exercises. So you can go for a walk or do some floor exercises at least for 30 to 40 minutes. That will be beneficial after this. At the time of breakfast, like 8 to 9 around, you can take chilas. There are a variety of chilas available. Like you can take moong dal ka chila, oats ka chila, makai ka atta you can use. You can opt for besan ka chila. But the most important thing which you need to remember is always take your flour and vegetables in the same proportion, like 1 is to 1 proportion. So that is going to give you a full result of your morning snack. So always add vegetables. You can use these carrots, beans, cauliflower, spinach, beetroot, any vegetables you can add in your dough and make chila out of it. You can add coriander leaves also along with it because coriander leaves has a very good weight loss property. And most of the women who are struggling with the PCOD, they are gaining weight very rapidly. So you can definitely add this chutney. Avoid taking coconut chutney in the morning. Let's next we come to mid morning time around 10 to 11. What you can have, you can choose smoothies made up of spinach, apple, oranges, or you can add some mint also in it. So vegetable or fruit smoothie can be taken at that time, but make sure that any fruit which is overripe need to be avoided. After mid morning, you can take your lunch around 1 p.m., 12 to 1 noon. That is the best time. You can take normal Indian thali, which we usually have, like two chapati, but that should be again high fiber chapati. You can add some methi leaves or palak leaves in your dough to make it high fiber chapati. Another way of making chapati high fiber is to add wheat bran powder in it, which is you just need to add 1 tablespoon of wheat bran powder in your dough, and that will be a high fiber chapati. Some people try to take multigrain chapati also when they are suffering from PCOD, but you need to make sure that you don't have any kind of digestive issues. If the woman is suffering from different digestive issues, I will not recommend them to take multigrain atta because adding more than two, three kinds of atta will not going to help you in terms of digestive health. So make sure that choose one or max to max two grains you can add. That is going to give you good results. Next one, you can take dal, like it should be high fiber dal. You can add it like methi, you can add it palak, or you can take moong dal along with lots of vegetables. In the same way, if you are not fond of taking a proper traditional Indian thali, you can have only a sprout salad or chickpeas ka salad at time. You can take moong dal salad. That is going to give you half of the needs. Like you are adding your protein with lots of fiber in terms of you're adding onion, cucumber, tomato, carrot, capsicum, whatever raw vegetables you want to add, you can mix it in your salad, and that will be a complete meal for you at that time. And you can add some fruit ball also if you are not taking not opting these options. You can take fruit ball also, but that should be mixed with dates, some nuts, melons, all these things. Oats porridge is another very good option who are looking for light kind of lunch. They can opt for oats porridge. Otherwise, always have a full thali instead of taking one or two items in the lunch time, because this is the time when your body need all the nutrients. So always take some time to have proper meal, which is lunch. After this, you can take some 3 to 4 time जो mid evening wala time है. You can always opt for lemon water, coconut water. These are good options at that time. If you want to have some food, you can take roasted chana, roasted makhana, or dry murmura bhel. You can add these things. In the dinner, I will suggest to take early dinner always, like 7 till 7 is always a very good time. Otherwise, max to max 7:30 should be there. So you should not cross the timing. Till 7:30 is always the best time to have your dinner, so that you will get some time before the bedtime. Like there should be a gap of 2.5 hours before your sleep and between your sleep and dinner. So that is going to give you good results in terms of digestion and absorption of all the nutrients. And always do some walk post meal. That is give you going to give you good results. that is going to give you, that is helping you to get rid of all the digestive issues and for better digestion. Another thing which you can take at the last is cinnamon water. At the bedtime, you can add cinnamon water, which is superfood and adding a lot of antioxidant, which is going to help you in terms of insulin resistance and for reducing the androgen levels, which are very much required in case of PCOD. So this is a sample diet chart which I just discussed here. Along with this, make sure to remember few simple principles while following PCOD diet. Make sure that you take your meals on time, which is very necessary. Always take small and frequent meals at regular interval. Don't take long meals and large gaps. Opt for local, seasonal, and fresh food. Opt for plant-based diet instead of taking animal-based food. Always have freshly prepared food at home instead of taking outside food. Avoid all the processed, canned, and preserved food. These are the basic things which you need to keep in your mind while following diet for PCOD.
Thank you so much, Dietitian Neha, for giving us this valuable information, especially with respect to the diet which the PCOD medical condition patients should follow. I believe our audience have taken a note of this and will be following these principles as well as the guidance you had provided. And ladies and gentlemen, please mark your comments in case if you have any questions or any suggestions you have. We'll be more than happy to cover those subjects as well. Until next time, thank you so much for watching. Thank you, Dietitian Neha. We shall
Thank you.
reconnect for one more subject. Have a good day, everyone.